With the FDA's announcement that the Pfizer COVID-19 vaccine is safe for children ages 12 to 15, some parents, guardians, and young people have questions of their own. We're covering that and more in today's To Your Well-Being. Cone Health's Pediatric Services Executive Medical Director, Dr. Michael Cinoman, is joining us. So let's first and foremost, let's start with safety. Safety of the vaccine. How safe is the vaccine for children as young as 12?
Fortunately, incredibly safe. It has been studied, and the short-term side effects are essentially exactly the same as they are for adults, which people are hopefully familiar with at this point. You get a sore arm. Some small proportion of patients can get fever, chills, fatigue, body aches, but otherwise the vaccine is incredibly well tolerated. And in terms of its longer-term safety, all the data that has been collected so far, both in the studies and our experience in adults, has shown the vaccine to be very, very safe and very well tolerated.
Yeah, we know that there were some adults who were worried that the vaccine, it was happening too fast even for them. So why should parents trust that the vaccine is safe for their 12 or 14 or 15-year-old?
This vaccine was done in incredibly rapid time turnaround as to typically how long it takes to get vaccines certified and through the Food and Drug Administration. But actually, no corners were cut in the development or study of the vaccine. These studies that were done were typically up to the standard, and the review that they went through by the agencies, the Food and Drug Administration, was the same as it would be for any other vaccine that's given emergency authorization. So the reviews were thorough. They were done independently from the people who did the studies, and the results were analyzed just like they were for any other vaccine. So yes, the turnaround was certainly quick for the benefit of the country and all the people and children who can now get it, and helping us get out of the pandemic. But it was studied very, very thoroughly, and many people have been vaccinated. The studies are still going on to evaluate how long people have immunity and whether there are indeed rare or unusual side effects. But so far, everything's gone great.
All right, well, let's talk about the efficacy rate, because we hear that it's 100% effective. What does that mean in, the little minor details?
Well, the study did show that it was 100% effective for 12 to 15-year-olds, which is in terms of a vaccine. And we're talking specifically, by the way, about the Pfizer vaccine, which is the vaccine that was studied for that pediatric age population. That's the only study that we received emergency approval for. But it was 100% effective in the over 1,000 children who received the vaccine in the study. There were no infections at all compared to the control group. So that's what's meant by 100% effectiveness. Now, in practicality, if you vaccinated 1 billion people, would it be 100% effective? I don't think anybody knows that answer. But again, with the evidence that we have, it appears to be, as far as vaccines go, incredibly effective at preventing disease.
Because I think the misnomer is you hear that it is 100% effective for adults, but they could still possibly get it. So they're like, okay, what does that exactly mean?
In children, actually nobody got it. Nobody got infected with it. But really what you want to achieve with most vaccines is it's pretty hard to create a vaccine where nobody actually gets infected. What you try to prevent, and what's so important with COVID for children and adults, is to prevent the complications. Unlike the flu and other colds and viruses that we see in children and adults, this one is absolutely not something that anybody would want. As you all know, many adults have died from this. Many have had severe lingering effects and been sick, not just for days, but for weeks at a time. This is a miserable, difficult, life-threatening infection. And although children can seem to get it less often and have less severe cases, it can be just as severe and life-threatening for them as it is for adults. It is, again, something nobody wants at all.
Mm-hmm. So here's the question. Are there any 12 or 15-year-olds who should not get the vaccine?
Very few should not get the vaccine. The exclusion population is very minimal, and it really is the same again as adults. The only people who it's really contraindicated for are people who have had a severe allergic reaction to the first dose of the vaccine, or have an allergic known allergy to one of the components of the vaccine, which is polyethylene glycol, which is a common, well-tolerated, essentially carrier for the material that the vaccine works in. And those, again, those are exceedingly rare. In terms of like what illnesses or special populations of children should not get them, there really aren't any at all. So we're recommending that just about everybody who's eligible should receive the vaccine. And in some senses, it's even more important theoretically in children with high-risk conditions who have a tendency to have a tougher time with viruses than otherwise healthy children.
All right, I know you touched on this just briefly, but let's talk about it a little bit in more detail about the side effects. Are they different in this age group compared to adults?
Again, no, they're essentially exactly the same, and the frequency that we see them are exactly the same. So whatever you've known about adults is exactly the same information we're telling parents about their children. It's very common, of course, when you get a shot to get a sore arm for a day or two. A relatively small number of children, probably under 20%, will get some type of what you would say would be a systemic reaction, where they'd have a fever, or just, if they don't have a fever, feel fatigued for a day or so, very tired. And then usually after 24 to 36 hours, it completely runs its course and people feel back to normal. And again, that's really the minority of the people that are getting the vaccine. Most tolerate it very well.
If they do have the fatigue, if they do have the fever, are there certain things that parents or guardians can do to treat them?
Yes, we recommend, just as they would those typical symptoms, it's fine to give Tylenol or ibuprofen, just as recommended and dosed for a child their size or age. Another common question we get related to that is, should I pre-medicate my child before they get the vaccine? And the answer is no. The American Academy of Pediatrics and the CDC do not recommend doing that. But if symptoms develop, it's perfectly fine to treat those with the usual medications.
And right now, where can children of that age, 12 to 15, get the vaccine?
Cone Health has been offering it since Friday of last week at one of our vaccine clinic sites. So there are really two ways the sites vary. There's a site in Burlington and the site in Greensboro Coliseum that we've had for many months available for adults. Now is giving them to 12 and 15-year-olds. People can find an appointment for that on conehealth.com/vaccines, or there's a phone number that you can call and make an appointment to. That phone number is, I have to look to make sure that I give that to you right. It's 336-890-1188. And walk-ins are accepted as well. So you really don't even need to do the two things. We like to have walk-ins 2 hours before the clinic is scheduled to close, just so that the clinic runs smoothly. And since you brought up our clinic sites, I would add that we've actually done special things for our pediatric population. There are pediatric trained clinicians that are newly there, that were not there before for adults. People who have given vaccines to children before, are comfortable with children. And we have tables that are kind of cordoned off from the adult area to make children and parents a little more comfortable when they get the vaccine. So there are people there who are experienced giving vaccines to our teenage population.
Mm-hmm. They are in good hands for sure. Okay, so Dr. Cinoman is going to be with us until 6, answering your coronavirus questions. What you need to do to get your questions to Dr. Cinoman is text us the question, 336-379-5775. We'll be right back.